All right, everybody, welcome. Thank you for your patience while we get everybody up and online and running. Appreciate it very much. My name is Casey Whiteola. I am the Public Relations Officer for Virginia Garcia, and I'm very excited to have so many of you here tonight with us. Welcome to the COVID-19 vaccine Ask an Expert. I see a lot of questions already popping up into the chat box. That's fantastic. We will be getting to most of those questions, if not all of them, at some point during the hour today. So please hang in there, be patient, but we will be doing our very best to make sure as many of your questions get answered as possible. Before we get started, I would like to take a second to thank the community partners that worked with us today and over the past couple of weeks, actually, to get the word out about this and other events. As you can see, the Spanish language version was last Thursday, so we've still got the header up there. So, but that is, these are all the partners that have been working with us for the past couple of weeks. We're very grateful for their assistance. There are several ways for you to participate today, and I would like to make sure that everybody knows you do have the chat, so please, and I see most people are taking advantage of it. So go ahead and continue to put your questions and responses in the chat. We've got a couple people monitoring the chat and doing our best to answer them. We've also are broadcasting on Facebook Live. So if you would prefer to watch it on Facebook Live or are experiencing Wi-Fi issues and would like to see the video, we are available on our Facebook page, VGMHC, Virginia Garcia. So you can head over there as well. So now I'd like to take a few moments to introduce the experts that will be joining us this evening. Dr. Laura Byerly, if you would go ahead and make your video live. And good evening. Dr. Laura Byerly is the Medical Director at Virginia Garcia Memorial Health Center. She's a graduate of Reed College and OHSU Medical School. She's been with Virginia Garcia for more than 17 years and is dedicated to the mission of providing high-quality health care for those who need it most in our communities. She currently serves on the Yamhill County Quality and Clinical Advisory Panel and is one of the 2 providers in the state that were recently appointed by the governor, Governor Kate Brown, to represent Oregon on the Western States COVID-19 Vaccine Review Board. So she's been in the trenches since the beginning of this with not only with COVID-19, but with the vaccine. We're super excited to have her on the webinar with us today. Welcome, Dr. Byerly. Let me introduce Christina, and then we'll give you both a moment to chat. Dr. Christina Baumann, welcome. And Dr. Christina Baumann is the Washington County Health Officer and a Tri-County Deputy Health Officer. She's a dual board certified in internal medicine and preventative medicine and received her residency training at OHSU and her medical training at the University of Michigan Medical School. She also earned a Master's of Public Health degree in Health Management and Policy. She's busy. Prior to joining the Health Officer program, Dr. Baumann worked as a primary care physician, health policy researcher, and medical consultant. Welcome, Dr. Baumann. All right, so super excited. Let's dive right in. But to kick things off, I'd like to ask each of you, have you been vaccinated?
I'll go first. Yes, I've been vaccinated. I had my second vaccine a week and a half ago. It was the Moderna vaccine. I had some side effects. I felt a little bit achy, tiny headache, a little bit like achy in muscles, achy in joints. I didn't have any nausea. I had a teeny bit of fever for like an hour on the second day. So I had it on Friday. Saturday was kind of tired and achy feeling. By Sunday, I was like, I feel totally normal. So that was my experience.
How about you, Dr. Baumann?
Yeah, sounds really similar. I had Moderna as well, losing track of time, but had my second dose, I think, last week or maybe a week and a half ago. I think with the first dose, really achy arm, like somebody whacked me really good in the deltoid muscle there. And same thing for the second dose. And for the second dose, the second day, so the day after I got my vaccine, felt a little feverish, pretty tired, achy. And then by the so the first day after my vaccine felt that, and then the second day afterwards, poof, everything was gone other than a little bit of an achy arm and felt fine.
Excellent, excellent. Yes, that's what I'm hearing is a lot of a little achy, not too terribly bad, plan to rest. So let's go ahead and get started. Dr. Byerly, I'm going to start with you. Um, we're getting a lot of questions in the chat around pre-existing conditions. Things like I have a heart condition, or my mom has diabetes. What is your advice for the COVID vaccine and pre-existing conditions?
So just for one thing for this conversation, Christina, if you at any point you want to like say, no, that's not quite right, or I want to add to that, please just jump in. Okay.
Well, yeah, and these two, and I apologize, these questions are meant for collaborative response. So Christine, Dr. Byerly, or Bauman, if you feel like Dr. Byerly is, left something out, feel free to add. We want to give these guys as much information as possible. We've got about 80 people on the line right now who are really excited to have some good information. So, feel free to add as much as possible.
So the pre-existing, there aren't many things that would keep you from getting the vaccine. There's like being allergic to something in the vaccine. The pre-existing conditions like diabetes and asthma and hypertension and heart disease, those are things that make a person at higher risk of having a bad case of COVID. Those are more reasons to get a vaccine than to not get one. And they may be things that allow you to get higher up on the list if you're not in the age group yet. But as we drop ages, we're going to get to people with pre-existing conditions ahead of healthy people because of that increased risk. I can't quite tell. The questions seem to be coming at this from both angles, so I'm not sure that answer gets to everyone's exact question they have. But Christina, Dr. Bauman, do you have any other comment on that?
Yeah, I would second what you said, that having those pre-existing conditions is a really good reason to get the vaccine. These vaccines have been shown to be really, really good at preventing severe disease from COVID-19. They keep people from having to go to the hospital and having really bad cases of disease. So having the vaccine is actually a really good thing for people that have these underlying conditions and health problems.
Excellent, excellent. And I think there is a question about, is one vaccine better than the other? Is Moderna better than Pfizer? Should they be leaning towards one over the other, looking for one more over the other?
Okay, well, I think we'll both have opinions on this. What the data we have so far is that all three of them, so that Johnson & Johnson one, or Janssen one, has just been given emergency use authorization, but they all seem to be very good at preventing severe illness and hospitalization. So that there's not much difference there. There's a convenience factor on the Johnson & Johnson one, which is one dose. And there's a lot of unanswered questions just because not enough time has gone by to do the follow-up study, which is going to run out 2 years. They're still following the patients who were in the study. So I think, and probably we're not going to be able to have a choice in which vaccine for a while, is my take on that. So they're pretty darn effective, all of them. They are slightly different in how they're made, but not very in terms of how they're working in our bodies. So at this point, I don't see a big difference to try to go to a lot of trouble to find one over the other. I would get the one you could get.
Yeah, I agree. There's a little bit of difference between the Moderna and the Pfizer as to the age groups that they're authorized for. So Pfizer is down to 16 and older are authorized for the vaccine, whereas Moderna is 18 and older. So that's one little difference. Johnson & Johnson is 18 and older as well. But yeah, as far as the populations that they're recommended for, all really similar, and how well they protect against severe disease, all really similar. So I wouldn't say one is any better than another, and I completely agree. We've got such limits right now in the vaccine supply, and so if there's an opportunity for you to get a vaccine, I would take the first one that's available to you.
I did think of another interesting difference. So the Johnson & Johnson vaccine, if you're listening to the news about the coronavirus, there are these new, looks like subtypes, the variants of the virus that are coming up. And because of the time in which the Johnson & Johnson study was done and the locations, that vaccine has been tested against different variants than the Pfizer and Moderna vaccines. The Johnson & Johnson was tested in South Africa, and so ran across the variant that's more common there and was effective. And similarly in Brazil, it was tested in that environment with a different profile of the kinds of variants there. And so it worked well in that against those variants as well. So that's one difference, but I'm not sure that would drive a decision at this point in time in the United States.
Awesome. Thank you. Dr. Bauman, this one will probably be more tilted towards you. We are getting a lot of questions about the new process for signing up, right? There's a lot of confusion around how do I get signed up? I mean, we did a poll in the last couple of weeks of our communities, and one of the top 3 questions that pretty much rose to the top in every poll was how do I get the vaccine? Where do I go? So can you tell us a little bit about what the county, and I know you're more closely connected to OHA, how does it all work? And this whole, put your name on a list and hope they call us thing. How does that work?
Yeah, so yes, things have been changing, and the hope is to continue improving. So the really big sites that we have for vaccination in the Portland area and Washington County, Clackamas County, Multnomah County are at the Oregon Convention Center and at the Portland Airport. And as you probably know, there is a tool, the eligibility and scheduling tool that was on the OHA website, where people would go through the questions and then get routed to any available appointments. And that just couldn't take the overwhelming demand on the system. And so just last week, the announcement was made to switch over to another system that the Oregon Health Authority, OHA, has developed, which is the Get Vaccinated Oregon site. And on that site, you can enter your information, your contact information, and learn when you're eligible, what sites are available in your area. So that is something that's been created statewide, and different counties have different opportunities available, and so they'll input that information in, and they will get an email about new opportunities. With the Oregon Convention Center and the Portland Airport site, what they're doing is they're taking all of those registrations and they're doing a random poll from that and sending out appointment opportunities to folks from that list. And they are trying to send a text message in advance of a phone call to get people scheduled based on the amount of appointments that are available for that week. So this is a interim plan right now, and they're working on improving it and learning from their experience right now. We may move to a different system in the future, but that is probably one of the best ways to both learn about new vaccine clinics that are in the area, as well as to get into that list and potentially get selected for an appointment right now. Washington County, on our website, we have a vaccine page where we're posting everything that we know about. And so there are some new sites besides those big vaccination sites that are becoming available. There's vaccine flowing to pharmacies now, and they've got a limited amount of appointments, but they are opening up. So you can check on there right now. It's Safeway, Albertsons, Walgreens, and Costco are some of the pharmacies that have some vaccine. And so we have those links on our website as well. Looking toward the future, because things are always changing, we're hoping that we'll get more vaccine flowing in. And so we may have a more stable location out at the Hillsborough Stadium, working with Hillsborough Medical Center, and the Washington County is working with partners to set up clinics in different parts of the county. And so any opportunities will be listed there on our website. So that's a good place to check. So that was a long answer to a really important question. And things are changing, but Washington County is committed to keeping our information up to date. So please check back on our site.
Great, thank you. Yeah, Dr. Bauman, I do have a slide at the end of this presentation with a URL to the Washington County site. So please, be sure and check that if you're interested in finding out more information. I also did put into the chat the Get Vaccinated Oregon .gov URL, so folks can click on that. Yamhill County, Barbara Card for Yamhill County. It's a similar situation. I've been keeping in touch with Yamhill County as well over the whole time about this, and they are doing a very similar thing. So I would Google. I can actually, well, in the next question or two, I will Google the Yamhill County URL and share it with the group so that you can, if you live in Yamhill County, you can go there. We do have a question I would like to address, just because there's a lot of variants of this one. Does the vaccine contain human DNA? Does it contain fetal matter? Does it contain, there's a lot of speculation about what is in the vaccine. Dr. Byerly, I mentioned at the beginning, you were on the COVID vaccine review board, so you've had an inside look in terms of what, of the vaccine itself. Dr. Bauman, you have most undoubtedly been very close to this. Why don't you guys speak to the science of the vaccine a little bit in terms of how it works and what it's made of and what it does. Dr. Byerly, I've heard your explanation a few times and I love it. So I'd like to start with you in terms of talking a little bit about the vaccine.
Okay, so I have a prop. This was made by the mother of one of our doctors. This is a coronavirus vaccine out of yarn. So the 3 vaccines that are now available to us under these emergency use authorizations all are trying to teach our immune system to react to these spike proteins that are on the outside of the vaccine. And it's the mechanism of presenting this to our body that's slightly different. The the Moderna and the Pfizer vaccines are using little protein fat packets that have the RNA, not DNA, viral messenger RNA to go, that it takes to our cells in that little packet to our immune system. And we start, our own cells start making for a few, like 2 days, those spike proteins. And then our immune system can see them and learn to be like, what is that thing? We don't like it. And we have both, we make antibodies to it with our B cells, and we teach our T lymphocytes how to kill cells that have that infection. So those two vaccines are using a little protein fat packet, and the Johnson & Johnson vaccine is using like a very mild cold virus that has been changed such that it cannot make itself. So the normal thing a virus does, it goes in your body, it gets in our cells, and it makes more of itself. The virus that is used to in the Johnson vaccine does not contain the information in its little packet to make itself. It only really contains the information to make the spike protein. So that, again, our cells make the spike protein, they stick it on the outside of themselves. Our immune system says, whoa, what's that? And learns to be immune against it. So that's the vaccines that we currently have. And I actually am not familiar with any upcoming vaccines, what those are going to be like. So there's no human DNA. There is no entire virus of any kind in any of these vaccines. So you can't get a viral infection from there's very complex, long processes in the vaccine factories where they're not going to have the whole virus, the complex many genes that are inside a virus are just not going to be there. They have to make this stuff. So they're not going to bother making things that aren't needed for the vaccine. The way, so RNA, and it can't go backwards into our DNA without special messages attached to the little strings of RNA. It's expensive to make this RNA, and they're not going to put extra messages on there that aren't needed for the vaccine. So there's no message to transcribe the RNA back into DNA to like get into your own DNA. That it's not in there. They'd have to do extra complicated steps to make that happen at the factory. There's no point to that. That's not what we're trying to do. I think that's what I can say about that. Want to make that more beautiful, Dr. Bauman?
That was great. I loved your prop too.
Yeah, I know. You can always count on Dr. Byerly for the fun props. I do have a question for you, Dr. Bauman, that's tied to this closely, and you can feel free to go back and add to what Dr. Byerly said, but I did want to get this out here before we got too far down the road. What about someone who's taking an immunosuppressant or being treated for tuberculosis?
Yeah, good question. So the vaccines in someone that is taking medicines to suppress their immune system or has a condition where their immune system is weakened, that's not a contraindication against getting the vaccine. It just is means that your immune system might not develop a very robust response to the vaccine and develop full protections like someone would have who has an immune system that isn't suppressed by medicines or by a health condition. So that is just a caution there. I don't know that they have seen any data or evidence to show that people who are taking these medicines or have these conditions don't develop full immunity. It's just a possibility. I think with those conditions and taking those medicines and having a weakened immune system, actually getting the infection with the and getting COVID-19 is actually a big concern because of how severe that illness could be. So the vaccine is probably the best chance to build some immunity that could help decrease how severe a disease you would have if you were to get the infection.
That's fantastic. Yeah, I think I would fully agree with that. So let me ask, once you get the vaccine and you've gone your 14 days, and so you've gotten both shots, your primary and your booster, and you've waited your 14 days, why can't you go out into public without a mask on?
I'm going to take that one.
Sure, I will go first on this one. So this is a good question. I have to say that. So the way that the studies were done, they were looking to see whether the vaccine prevented cases of symptomatic COVID-19 and if they protected against hospitalization and disease. They didn't actually test all of the participants to see if they might be carrying the virus or having gotten an asymptomatic infection or an infection without symptoms. So that is sort of this unknown that we're dealing with here. And so we know that the vaccine protects you against getting severe disease and it protects you against getting symptomatic disease, but you might be carrying the virus in your nose and your mouth and potentially be able to spread it to other people. And until we know better, until we have more data and studies out there, because we've got so much virus circulating and we're trying so hard to tamp down on cases and get this pandemic under control, we really think that wearing masks and continuing to do distancing even after you've been vaccinated is a really reasonable precaution, and until we can know more about how effective these vaccines are at preventing infection and asymptomatic infections. That's one reason. And then the other reason is with these different variants, with the different strains of virus that are circulating, we don't know. There may be new ones that come out that the vaccine doesn't fully protect against, and we don't want those to spread any more than they are right now. And so continuing some of these precautions helps also decrease the amount of spread of different mutations and different variants that are out there that could cause problems down the line. Dr. Biley, do you have any other thoughts on this?
Yeah, I think just to elaborate on the complexity of the study, to study every question that we want to know. So we've got about 50,000 people who are in the vaccine receiving arms of the 3 different studies, and they just couldn't ask every question and get the answer for all of the questions that we have. So they asked the important ones, like, does this keep you from dying? Does this keep you from going to the hospital? That was kind of our, like, getting really sick with COVID. That was their main question. They found out some other stuff around the edges, but they just couldn't answer every single question. And they're still following up the people. The companies still have a 2-year run out. So we will definitely learn more as we go.
Yeah, and as with everything, we're learning as we go, and so our guidance may change down the line if we get additional information that it actually prevents the spread of the virus in the community. So right now, this is the best guidance that we have based on the best available information that we have.
So here's a kind of a follow-up question to that. Well, it's actually a follow-up to the previous question, which I suspected there might be. What is RNA as opposed to DNA? without getting too sciencey on us here.
Okay, so I'll try. So you got your cell, right? We have 30 trillion cells in the average body, and each cell pretty much has inside it a nucleus, like the core part that has our genetic material. And that genetic material, our genes are in our chromosomes, and those have DNA, or deoxyribonucleic acid. So that they sit in there and they contain the code, the secrets of our life, right? So but the code is there to do stuff. It's instructions for how our cells live and what the different parts of us do, to make hair, to digest, make enzymes to digest our food. So the information has to get from inside the nucleus, in the chromosomes, in our genes, out to the parts of the cell that make stuff. And the messenger RNA, or ribonucleic acid, is what does that. So the cell opens the double-stranded DNA, and a copy is made of one of the strands, and then that goes outside of the nucleus, out to the apparatus, the various things and parts of the cell that make proteins, and that's RNA. So it's a messenger from our genes, which are double-stranded DNA, to the single-stranded RNA that goes out and tells the cell to do the various things it's supposed to do. Hopefully that's good enough. Otherwise it gets really long.
Dr. Bauman, do you have anything to add to that?
That made sense to me.
It did. I would hope so. All right. So here's a simple one, hopefully. Does the vaccine have to be put in the same arm? And it doesn't have to go in the arm? Could it go in the leg? Could it go anywhere else?
I think it needs to go in a muscle of the right size. I have not read anything that it has to be in the same muscle twice. And if you are unfortunate to not have an arm, we would have to find a different muscle to put it in. Yeah. So do you know anything different?
Yeah, that's absolutely right.
And it does not have to be in the same side, correct?
It does not have to be in the same side, because really what's happening is that you're getting an immune response throughout your entire body. It's just that the vaccine got put into that muscle. So it doesn't have to be the same muscle. Your body will respond to it the same way if it's in a different site.
So we've had a couple questions about folks that have in the past had a flu shot or a tetanus shot and had terrible reactions to it. Like their body, they were sick for several months after, a flu shot, or they just didn't have a great reaction to the tetanus shot. Should these be things to be concerned about, maybe to talk to their provider about before they go and get their shot?
I think they're made in such different ways that I do not think there would be a cross reactivity between the Moderna, Pfizer, and Johnson & Johnson vaccines. Like the flu shots are those vaccines are grown in eggs. I don't remember tetanus. Can you remember tetanus? Is there anything that would be similar with tetanus?
I don't think so. No, in the screening questionnaires that we ask people if they've ever had an allergic reaction to a vaccine before. And that isn't, unless it's the COVID vaccine that you had a severe allergic reaction to, that just means that we're going to keep an eye on you in case you have another allergic reaction. But other than that, as far as other types of events or symptoms that people had, that is not a contraindication to getting this vaccine.
Yeah, it's allergy to the ingredients of the vaccines themselves is the contraindication. And those are at the FDA meetings, they really came up with some really weird unusual medicine that I hadn't heard of is one that contains some of those ingredients. So it's a rarely used medicine. And so if you're using a rarely used medicine, I'm sorry, I cannot remember the name of it because it was not one I had even heard of. So, and they had to scratch their heads for a while to come up with that. So that would be it's really very specific to the ingredients in the current vaccines. They have to worry. So you would have to sit there for 30 minutes instead of 15 if you had a severe immediate reaction to something in the past, but you could still get it.
We always, and I think we always say, you know, if you have concerns and have had reactions in the past to vaccinations or to other shots, you know, always default on the side of safety and err on the side of safety and talk to your doctor. So one question I think either of you could probably answer that we've received a couple times is how often am I going to have to get the COVID vaccine, and how long does it last?
Sounds like a public health question to me.
Yes, so these vaccines are relatively new in the whole timeline of vaccines. So right now, for the Moderna and the Pfizer vaccine, there are 2-dose series, and we don't know how long they'll be effective for, meaning we don't know how long you will, after getting the vaccines, maintain immunity to the virus that's circulating now. If there's a variant of the virus that develops down the line that somehow has changed so much that it escapes the protections of the vaccine, there would need to be a change in the formulation of the vaccine that could require that people get another version of the vaccine to protect against that variant. So right now, and with other vaccines, we've seen that, like with flu, there's a flu vaccine that's developed every year to protect around what's circulating. So that's something that we've seen before that could be possible with the coronavirus. We don't quite know yet what it's going to look like and looking into the future. As Dr. Byerly mentioned, these studies are ongoing, and they're still watching people that have received the vaccine and haven't received the vaccine to see how long that protection lasts and how long it protects against symptomatic disease and hospitalization. So that will give us some really good concrete data. And then public health is really closely watching. I think you may have heard in the news, there were, I think, 4 cases of people who had gotten vaccinated who then got diagnosed or tested positive for COVID-19. And so public health and all of our surveillance is looking really closely at anything we're calling breakthrough cases, to understand how often that happens, whether people get severe disease or not, how long after their vaccine they got diagnosed with the infection. So all of those things we'll learn over time. So it's kind of hard to say right now concretely how long the vaccine will last and when or if we would need to get a booster to maintain protection.
All right, thank you. So what is the biggest difference between the Johnson & Johnson and the Moderna and Pfizer appears at this time to be that Johnson & Johnson only requires 1 shot, and Moderna and Pfizer have a primary and a booster. Is there any other differences between the vaccines that we know of at this point? From a consumer standpoint, not from a provider standpoint.
The side effect profile immediately after the vaccine seems really the the same from the study participants, right? People had sore in their arm and maybe a little fever, maybe achy muscles, maybe a little headache, a little bit of nausea. There seemed to be, they didn't have, maybe people have hives. Hives didn't come up very much in the other one. Maybe there's a hives factor that might come up. You know, out of the 40,000 people, there were hives in both people who got the vaccine and didn't get the vaccine. So it's one of those things like, well, it's hard to know for sure. And they did the study a little bit differently. So it's hard to compare them exactly, but the really important endpoints of their protection seem very close to equal. And it's certainly more convenient to get one dose, right? You don't have to keep track of that next one. Get into your clinic and getting in line and all the stuff that happens. Anything you want to add to that?
Yeah, I think we touched on this a little bit to the other question about whether one was better than another. I think that the main thing that it's protecting against is serious disease and hospitalization, and they all seem to be really good at doing that. And from the safety standpoint, they all have a really good safety profile. So yeah, not a lot of differences that I'm seeing there.
Great. A question maybe for you, Dr. Bauman, is, how do we know which vaccine will be at which location? So if we are thinking that we want the Pfizer vaccine, is there a way to steer yourself towards that? I know Dr. Byerly said earlier, get the one you can get. At this point, just get the one you can get. But if somebody's really set on Pfizer or really wants the Johnson & Johnson because they only want to go one time, is there a way to find out where those vaccines are being given?
So at the large vaccination sites, they're using whatever supply they receive, and so it's either been Moderna or Pfizer, and sometimes even on the same day they have either one of those, and it's really hard operationally to assign one type of vaccine based on a person's preference, just because the vaccine's been so scarce. Johnson & Johnson is just now coming out, and I don't think we have a good sense of how it's going to be distributed, whether pharmacies are going to be more likely to get it versus clinics versus health departments. So that's yet to be seen. Typically in the scheduling, because there isn't much difference between the vaccines, that isn't included in the information that's put out. I'm sure if you were to inquire, they may be able to tell you what vaccine they're using that day. And potentially with the pharmacies, they may be able to show what they have in inventory, which one of the vaccines. So I don't think there's an easy way to find out, unfortunately.
Okay. Let's see. Well, it's already 6:50. The time has flown. I'm going through the questions. There's a lot of similar ones. We've got some on Facebook that talk about asthma as an underlying condition. Is that considered an underlying condition as a health risk? Maybe I think Dr. Bauman, you may be able to answer that. But we did have that question on our Facebook Live page. But folks, if you've got any more questions or anything that hasn't been answered, please, put it into the chat now, and we will definitely get to you. We have one from a young woman whose son is autistic and is subject to seizures. Now, obviously, without knowing full medical history, you're not going to give medical advice. But has COVID-19 shown in the people that we have vaccinated to have any adverse effects for folks that are subject to seizures, or has it shown to trigger seizures that either of you know of?
I have not seen that as an official warning of the vaccines.
Yeah, seizure. So on the Pfizer and the Moderna, that seizures were not, they didn't pop up as like different in the two groups, the people who got the placebo and the people who got the vaccine. Those weren't different. Things like Bell's palsy was different, like more people with the vaccine, a little bit more with the vaccine got Bell's palsy, which is that half your face goes, can't move thing that you might see people have. But seizures didn't pop up. And certainly I haven't heard any news about in this vaccine safety since then about that.
Okay, that's great. Let's see. Let's go with some more of the long-term effects. There is some concern voiced on the chat and in Facebook Live about long-term effects. So obviously you can't know long-term until you're actually long-term, but has there been any indications? What about for pregnant women or for women who want to become pregnant? I actually was in a clinic recently and saw a pregnant woman getting the vaccine. So I'm going, my understanding is that it is relatively safe for pregnant women, or there are no indicators that it's not. But I will leave it to the doctors to confirm that and to talk a little bit about future, if you're thinking about getting pregnant, is there anything you should be considering? What about if you've had COVID? Should you be getting a vaccine? Let's cover those topics.
The CDC is saying if you've had COVID, maybe give it a 90-day break before you get your vaccine. But that's not like, this is an area that's not well studied, but that seems to make sense that we think that the immunity that comes from the virus will go that long. So you have protection for a little while and then you can get your vaccine. And pregnancy, there's some people in the studies who did get pregnant despite, that wasn't the plan, but they did get pregnant, and the results that were known at the time of the emergency use authorization were that there had been no bad effect yet, but they hadn't all, completed. The pregnancies babies weren't all born yet, but nothing obvious had come to show. And then the mechanism of how the vaccine works, it's like hard to think how it would have an impact on the fetus. So it is thought to be safe. It just is by looking at the mechanism and thinking about how it would hurt the fetus, it doesn't seem like it would, but there isn't a lot of data still. And that's part of the follow through of the study to figure that out better.
Yeah, and I would also add that, whenever we talk about intervention like a vaccine, we're also looking at, and the health impacts of a vaccine or any possible side effects or rare adverse effects. That's in balance to what can happen if you get the infection itself. And we know that getting COVID-19 can make you severely ill, has caused many, 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 many deaths. And we also know that for pregnant women who get COVID-19, they are at risk for severe disease and potential bad outcomes too. And so I think that's part of the decision making, right? Weighing the unknown,
weighing those things,
and then weighing the knowns of the risk of the virus and getting COVID-19.
Excellent, excellent. Let's circle back real quick. We kind of skated over it, and they're asking for clarification. Asthma. Is asthma an underlying condition for COVID-19? Would it make you eligible sooner? They haven't seen it listed on any of the OHA eligibility graphs, and so they're wondering, is that considered a pre-existing or a health condition that would get you earlier vaccination?
I think there are two, like if you look at the CDC website, they've got these list of conditions will make you have, they're really highly likely you'll have a more severe case. And these over here might make you have a more severe case of COVID and thus make you more of a candidate to get the vaccine. And I don't know if Oregon have we, it feels like there's a little bit of gray still in the list of things that are going to put you in the next group of people who have a pre-existing condition and thus put you at higher risk, and thus you need to have a vaccine sooner. I think there's some judgment call that still has to be made there, but so CDC says yes, it might well give you a higher chance of getting a bad case of COVID. But I don't know that means what Oregon's going to do yet.
Yeah, on the Oregon Health Authority website, now that the new categories for future eligible groups has come out, they are trying to put out more information about chronic conditions that are eligible. They have a list, but there have been a lot of questions coming about that list and different scenarios. So I think we can anticipate some additional guidance to help better understand eligibility within those groups as well as other ones too.
Great, great. All right, well, it is 6:58. So I'm going to basically give each of you an opportunity to summarize if there's something that you didn't get to say, if there's information that you would love to share but did not get an opportunity to share. Speak now or forever hold your peace. And then I will go ahead and jump over to the resource page for everybody. If you want to hang on just a few more minutes past 7 o'clock, I will put up the resource slides so everybody can get the resources that are needed.
Chris.
I would say thank you to everybody that joined and who's seeking good sources of information. I hope we answered your questions in a way that was understandable and that you can take back and maybe explain to other people around you who have similar questions. There is misinformation out there about the vaccines and rumors can spread pretty quickly. So I think it's pretty important to seek out good, reliable sources of information, whether that's I think the CDC actually is doing a really good job at putting out information that's pretty understandable to help people make decisions and understand more about these vaccines and about COVID-19. So I think, yeah, just keep seeking out good information and spreading good information as well among other people that you care about and making these choices about getting the vaccine or not.
I am really excited to hear from people who really want this vaccine. I'm sorry that we can't give it to everybody all at once. That would be really great, and that would really help get rid of this pandemic. So as Dr. Bauman said, the flow is going to improve. It's going to open up, and we will get to a place where it's not quite so frustrating. But I'm really glad you're here. I'm really glad you're interested. And if you can influence anybody to tilt towards the positive on getting a vaccine, that would be great. So thank you. It's been fun.
Thank you to all of you, to both of you for spending your time and your evening with us. We really, really appreciate it. This is really, really important information, and you guys did an excellent job of sharing it and breaking it down for all of us. I encourage everybody to, if you're still on the fence or still trying to do your research or still have questions, to go out here, start at these websites and really just, dig in, look for good information, ask the questions. There's always people who want to answer them. And thank you again. You're a big step by spending time with us today. I'd like to, before I go, I'd like to thank Dr. Byerly and Dr. Bauman again for their very, very precious time with us. I'd like to thank my production team who's on the back end answering all the questions and making sure the chat stays lively and Facebook Live stays lively. So I appreciate you guys immensely for keeping me honest. And everyone, have an excellent, excellent evening. Be safe out there, and good night.